So already 11:33.
No, it's 11:30, ma'am. Sharp 11:30, sir. So with all your due permission, we are beginning with the session for today.
Yes, I'm ready.
Thank you so much, sir. Good morning, everyone. This is Batul from IGCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared by our eminent stalwart who is present here with us for today's session, where he is none other than the very renowned Professor Dr. R.K. Manohar, sir. Sir is MBBS, MD in PSM, Professor and Head at NIMS Medical College, Jaipur. With Sir's wonderful insights and with Sir's wonderful experience, we are going to talk about today's session on epidemiology of rabies, which is the topic for today as on World Rabies Day. The topic is epidemiology of rabies on World Rabies Day. So let us know more about the topic, what it says and what it suggests. On this World Rabies Day, we'll be understanding the epidemiology. This deadly viral disease, primarily transmitted through animal bites, affects tens of thousands of people globally each year, with most cases occurring in Asia and Africa. Effective rabies prevention measures, such as vaccination and animal control, are crucial to reducing its impact on public health. So now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him so that he can enlighten us with his wonderful thoughts upon it. Sir, over to you.
Thank you, ma'am. And you have already given my introduction. So I will start from topic rabies, epidemiology of rabies. Why the topic is selected today? Because today is World Rabies Day. The theme of the day is all for one and one health for all. All for one and one health for all. This is the theme of the day. And today we are celebrating 17th World Rabies Day. This is background. Now I start with the topic. Rabies is 100% fatal viral disease if not treated. A person who develops rabies have to die. At present, there are two viral diseases having 100% fatality. One is rabies, that is preventable. Other is HIV.
So sorry to interrupt you. Your PPT presentation is not on screen, sir.
Is it not visible to you?
No, it is not, ma'am. It's not yet in the share screen mode.
Okay, we will share it later on. Now the sir should start with the presentation. We'll give you the presentation and you can share it on the group afterwards. Is it possible?
Yes, that is possible. But since he has a presentation, if he could have presented on screen, that would have been better with the talk, ma'am.
Obviously, but that is, I don't know why there is no such problem is there on our end. We are able to see.
You share it again because it has been stopped sharing, ma'am. That's what I'm saying. It has been stopped sharing. You have to share it again.
I will try my level best to return it. Just a moment. Give me 1 second. I'll reshare it at your end.
Yes.
Okay.
Yes, ma'am.
Is it now visible?
Yes, ma'am. It is visible.
Thank you.
Now visible?
Yes, ma'am. It's visible now.
So today World Rabies Day, 20th September. being celebrated since 17 years. The theme of the day is all for one and one health for all. So one life of one person is as precious. That is why the theme is taken on this ground that not a single person should die because of rabies. Rabies is 100% fatal, but preventable. There are two viral diseases in the world having 100% fatality. One is rabies and other is HIV/AIDS. In HIV/AIDS, treatment is there. So it is now considered as chronic manageable disease. While rabies, there is no treatment. Once the disease is developed in the human being, one has to die. What we can do is we can prevent the disease by giving vaccination timely. This is very important. As soon as person is bitten by a rabid animal or wild animal or any animal, stray dog, patient should consult doctor as early as possible, no delay. Because if virus reaches to the nervous system and locks the nervous system, then it will travel through the nervous system to brain, spinal cord, and central nervous system, and the ultimate is death. So prevention should be started as early as possible. Vaccines are available in the market, in the government hospitals, government health centers. So on this day, our main objective is to create awareness about its prevention. Prevention by vaccine. Suppose a person is bitten by rabid animal, wild animal, or stray dog, or by cat or bat. In that situation, first of all, wash the wound immediately with water and soap. Here I would like to mention that soap should be detergent soap because the virus has got lipid coat of lipid material, and detergent soap will dissolve that covering and will attack the virus. So the soap should be detergent. Second point, never ignore animal bites or even scratches. Intact skin, the virus cannot enter in the body, but if there are bites, that is penetration of skin, scratches on the skin, sometimes not visible, through these scratches, the virus may enter in the body. Third point, very important, consult your doctor, visit hospital for anti-rabies treatment without delay. The word without delay is very important in this. If a person is bitten today and consult doctor after 15 days, then it is a not delay but big delay. Average incubation period is 2 weeks, and sometimes incubation period is up to 1 year, depending on the site of bite, severity of bite, protection provided by clothes, and immunity of the person bitten by the animal, and nutrition status of the person. This is simple picture showing that the virus, if it infects the nervous system, it will cause the disease. Once it has reached the nervous system, entered the nervous system, it will travel through the spinal cord, reaches the brain, and the disease will develop. Our objective is to prevent the disease by blocking the nervous system through antibodies. If vaccine is given in time, antibodies will reach first and they will block the entry of virus in the nervous system. No delay should be there in animal bite cases. Rabies virus is transmitted through saliva, mainly through saliva of a rabid animal or the tissue which is infected with virus. Brain is infected as rabies virus enters in the nervous system and contact with these specific body excretions and tissues. Rabies is transmitted only when the virus introduced into the bite wound, open cuts in skin, or to mucous membranes, such as mouth or eyes. When mucous membrane, it is thinner than skin, and entry of virus through mucous membrane with scratches is more easy as compared to entry through skin. Intact skin is difficult to enter the virus. For the virus, it is difficult to enter, but if there are scratches, then chances are there for virus to enter in the body. Any penetration of the skin by teeth constitute a bite exposure. In case of non-bite but contamination of open wounds, abrasions, mucous membrane with infectious material constitutes a non-bite exposure. Non-bite exposure is not so common as compared to bite exposure. Now, local treatment of wound. For example, third degree, there we have WHO has given classification of the wounds in 3 categories. First, second, third. Third is severe, when there is lacerated wound on any part of the body, 5 or more wounds, or bite on genitalia, or bite below wrist joint, or bite in neck or above, head, face, neck. These categories are considered in class 3 exposure, severe bite, severe exposure, and along with local treatment, washing of the wound with soap and water. Rabies immunoglobulin is also recommended, that is 20 international units per kg body weight. If we are giving equine serum, then the dose is 40 international units per kg body weight. Half of the antibodies are given locally on the wound area, spread on local site, and half is given intramuscularly. If a rabid dog is there and he bites, suppose 100 persons, all will not develop disease. Only 50 to 60% will develop the disease, because virus in the saliva is excreted intermittently, not regularly. If without treatment, 40% will not develop the disease. But we don't know who are those 40%. So in severe gut grade 3 bite, we have to give treatment, complete treatment of vaccine, full course. Nowadays, intradermal vaccination is approved by the government and it gives equal immunity as compared to vaccines given intramuscularly. The virus, after from local site, multiplies and reaches to central nervous system through peripheral nerves and reaches ultimate to brain. Once the brain is infected, then no doctor, nobody can treat the patient. Rabies is in animals, hydrophobia in human beings. Hydrophobia means the person who develops the disease will have fear of water. He cannot drink water. Even listening the name of water, he will have severe spasm. And for such patients, they need treatment in isolation ward. Following category does not constitute exposure, petting, handling of animal, contact with blood, contact with urine or feces. Here I would like to give advice. The persons who keep pet animals should get their pets vaccinated timely as per the advice of veterinarian doctors. Vaccination among animals is equally important. If the dog is not vaccinated properly as per routine immunization among the dogs, then the owner of the pets, they are responsible to keep the immunization card of the pet and check the vaccination of their dog that when the next vaccination is due. These are the negative bodies in the brain which develops after the disease develops in the human beings. They are 100% gold standard that the person died of rabies. Incubation period may be short as 2 or more, but in rare cases it may be long as 1 year. Depends on many factors. Protection provided by claws, severity of the bite, site of the bite, immunity of the host, nutrition status of the host. Bites are more severe, more risky if above head and neck and above, below wrist joint, lacerated wound, more than 5 wounds, or bites on genitalia. They should be put in grade 3 exposure. Washing the wound with soap and water is very important. Soap should be detergent soap. And if the person washes the wound with soap and water at least for half an hour, 99% chances of infection is removed. 99%. So importance of washing the wound with soap and water is very important. Here I would like to mention that if the wound is lacerated, never go for suturing. If there is excessive bleeding, then in such cases, loose sutures may be applied. Otherwise, as far as possible, sutures should not be applied in animal bite cases. This is about vaccination of dogs, pets. Time to time vaccination is very important. And vaccination cards should be kept in a proper place, so time to time vaccination can be done in these animals. Now the problem is regarding stray dog population. Government, municipal corporation, what they are doing vasectomy of the dogs, of stray dogs, so that the population of stray dogs does not increase and they are not harmful to the society. Classification of exposure, WHO grade, there are 3 grades, grade 1, grade 2, grade 3. Grade 3 severe, grade 2 moderate, in moderate category, less than 5 minor wounds, and on any part of the body, except below wrist, above neck and above, and extragenital. In these areas, even 1 or 2 bite is grade 3. Grade 1, scratches, drinking unboiled milk of rabid animal, then also it is category 1. Nowadays, good vaccines are available in the market, health centers. So prevention is very easy as compared to prevention activities done 20 years, 30 years ago. Even the vaccines are available at the level of towns. Initially, the vaccines were available in the big cities only. Now the vaccines are available at lower levels also. And at community health center, district hospital, tertiary care hospital, where medical college is situated, vaccination is free. Government institutes are providing free vaccination, no treatment. And the persons who are taking treatment at private clinics, private hospitals, then they have to pay for the vaccines and the vaccine may be given. Grade 3 exposure is more than 5 wounds, wound on the bite on the face and bite on, and again more than 5 wounds and lacerated. Why bites are more common in children? Children are more affected by animal bite as compared to adults. Number one, because of small size. Their size matches with the height of the dog, animal. So they are more prone to get bite on the face, neck, and above. Then comes provoked, unprovoked bite. Unprovoked bite is more dangerous as compared to provoked bite. When animal bites without provocation, that is more dangerous as compared to provoked bite. There are different regimes. Thai Red Cross regime, verified Vero rabies vaccine, verified chick embryo cell vaccine, and verified duck embryo cell vaccine. Dose depends. If we are giving intradermally, then dose is 0.1 ml. If we are giving intramuscularly, the dose is 0.5 ml. Upper arm or and in the deltoid muscle. Now the schedule is different. The schedule is on 0 day. 0 day is day of taking vaccination, not day of biting animal. Day of vaccination, 0 day, 2 doses are given on both arms in deltoid muscle. 3rd day, 2 doses. 7th day, 2 doses. 14th day, no dose. Then 28th day, 5th dose, and 90th day, 6th dose. Intradermal dose is 1/5 of the intramuscular dose per site. When intradermal dose, it is proved that, scientifically proved that it gives equal immunity as compared to 0.5 ml or 1 ml dose, then why to go for 5 ml, 0.5 ml, 1 ml? Intradermal vaccination is nowadays in government institution, hospitals, intradermal vaccination is done, and that too by trained personnel who is appointed in anti-rabies clinic. 2-site intradermal regime, 0 dose, 2 doses on each deltoid muscle on both sides. Then 3rd day, 7th day, 14th day, no dose, 28 days, 19 days. So 2, 2, 2, 0, 1, 1. 0, 3, 7, 2 doses on both arms. 14th day, no dose, 1 booster dose, 28 day and 90 day, second booster. Right? 28 day and 90 day are considered as booster doses. in 1 ml intradermal site. Schedule: first day 2 doses, second day 2 doses, then third day 0.3, 0.2 doses, third day 2 doses, seventh day 2 doses, 14th day no dose, and 28th day 2 doses. So there is no need to go for 90th day. We are giving 2 doses 4 times. 0 day, third day, 14th, third, 7th day, and 28th day. Now, pre-exposure vaccination, although it is recommended in persons who are working in laboratories, handling rabid animals, or in veterinarians, or doctors, paramedical staff working in anti-rabies clinic, but pre-exposure vaccination is taken by very, very few people. Because once they are not bitten by animals, nobody likes to take vaccine. Theoretically, we have mentioned that vaccine, pre-exposure vaccination should be taken by the persons who are entering in the endemic area of the rabies, where dog population is there. Rabies is a problem, but practically people are not taking pre-exposure vaccination. But those persons who want to take pre-exposure vaccination, they should be provided with pre-exposure vaccination. For example, traveling to a country where there is increased incidence in rabies, pre-exposure vaccination may be recommended. But when we see in practical aspects, vaccination, nobody will take pre-exposure until unless exposure with the in form of bite or exposure with in caring of the patient of rabies, hydrophobia is there, contact who comes in contact with the patient, they will take pre-exposure vaccine. These are the different categories where they take pre-exposure vaccination. This is important fact. Although pre-exposure vaccination does not eliminate the need for additional therapy, rabies immunoglobulin is needed if the person who is taking pre-exposure vaccine, if the person
एक वो मुझे पहले तो
eliminating need of rabies immunoglobulin and decreasing the number of doses of vaccine needed. So in case of rabies exposure in those persons who are taking pre-exposure vaccination, rabies immunoglobulin in grade 3 category. Category-wise treatment will be given and it will be more effective as compared to those persons who have not taken pre-exposure vaccination. In pre-exposure vaccination, who have taken the requirement of rabies immunoglobulin may not be there. Human diploid cell vaccine is one of the best vaccine because it is developed on human diploid cell and there are no chances of allergic reaction. Although other vaccines are available, HDCV is still considered #1 vaccine, human diploid cell vaccine. But looking at the cost of the vaccine, government centers are giving vaccines, chick embryo cell vaccine, duck embryo cell vaccine, or vero cell embryo vaccines. They are also equally effective and giving good results. But main advice is to take vaccine in time without delay. That is the key to prevent rabies against dog bite, animal bite. In human diploid cell vaccine, or purified sick embryo cell vaccine, the dose is 1.0 ml, 0.728 days. But the effectiveness is calculated in terms of antibody titer estimation, with 0.1 ml intradermal vaccine, the antibody titer is sufficient after 5-7 days as compared to human diploid cell vaccine. Practically, the person comes to anti-rabies clinic or consult doctors when it is bitten by a dog or wild animal. Wild animal bite is more dangerous than domestic animal bite or stray dog. Cat bite is more dangerous than dog bite. So vaccination should be done timely. Vaccines are available. It is duty of the doctor to start vaccination immediately. And it is duty of the patient and his attendant to report that to the doctor without delay. So responsibility lies on both person who are bitten by the dogs and person who is treating the problem. No delay should be there as far as possible. And the rabies does not spread from rodents. Many times patient consults, I am bitten by a rat, what should I do? The rabies does not spread through rodents. This is already established. Now the rabies spreads from the animal who is sick and having disease, and behavior becomes abnormal. So any animal biting many people, the person should be given vaccination. As rabid animal may bite single person also. So any bite should not be ignored. As mentioned in theme of this year, all for one and one health for all. Not a single person should die of rabies. This is we can do by creating awareness among people and creating awareness along with informing people that vaccine is available. Nowadays, public knows vaccine is there, and it is the responsibility of the pet owners to vaccinate their pet timely, because there is no vaccine which gives 100% protection. So if no vaccine gives 100% protection in human beings, for example, maximum protection is given by measles vaccine up to 95%. Only one vaccine which used to give 100% protection was smallpox vaccine. That's why the disease is not there in the world. So our duty is to provide maximum benefits to the persons by giving vaccination, and pet owners should vaccinate their pets timely. Thank you.
Thank you so much, sir, for your wonderful insights upon the topic that you have shared today with us on World Rabies Day. We would like to put up the questions that we have received from the participants with all your permission, sir.
Okay.
Yeah, the first question is, which results of cardiac monitoring are characteristics of rabies?
Once the person develops rabies, he becomes hyperactive.
Okay.
And after 1 or 2 days, he will stop drinking water, and even if we ask person to drink water, he will shout in a different way. The voice will be different. He has developed fear of water. That is why the disease is known as hydrophobia. First is hyperactive. He or she will become hyperactive. Then one has to take history of animal bite in last 6 months, because incubation period is variable. It may be 2 weeks, more than 1 year, but if we take history up to 6 months, it is sufficient. But in wild animals, I have worked as anti-rabies clinic in charge for 7 years in one of the medical college hospital of Jaipur, SMS hospital. I have seen a person developing rabies within 3 days, bitten by he visited animal zoo. He was bitten by lion, tiger, and lacerated wound was there, sutured by surgeon for at least he gave 12 to 14 hours, and the child developed his hydrophobia within 3 days.
Thank you so much, sir. Thank you for answering this question. We will move to the next question that we have received. And the question is, who should conduct follow-up evaluations in patients with rabies?
Ma'am, I couldn't understand, ma'am.
Can you repeat the question?
Yeah, sure. The question is, who should conduct follow-up evaluations in patients with rabies?
Oh, follow.
Yes, sir. Follow-up evaluation in patients with rabies.
Ma'am, per person who develops rabies, his survival is not more than 5 to 7 days. And if he is admitted in isolation ward, because of the severity of the disease, paramedical staff, they have to take a lot of precautions, and a disease in which there is survival period is 4 or 5 days, then no question of follow.
Got it, sir. Thank you so much for answering that question. We will take up the next question that we have received. And the question is, what are the conditions to consider in the differential diagnosis of rabies?
Yes. This is a very good question. Then I have seen person who is bitten by dog, but not developed rabies. Because of psychology of that person develops after bitten by a dog, stray dog, not traceable, he develops psychology that he will develop rabies. And the condition which he develops is not rabies, but not hydrophobia, but pseudo-hydrophobia. It is a psychological disorder. Person needs psychiatric treatment because he thinks that he has developed rabies, which he has not developed rabies. He has developed psychiatric problem that he will develop rabies because he is bitten by a dog. And that is why it is known as pseudo-hydrophobia. Hydrophobia is not there, but pseudo-hydrophobia. Such patient needs psychological treatment from psychiatrist, and there is no need to give any vaccination or any treatment related with dog bite, animal bite.
Thank you so much, sir, for answering this question. With this, we would like to thank all the viewers, since this was the last question to us. Thank you so much to all the viewers for their patient listening, and so thank you so much to you for taking out your valuable time and for being here at our platform and sharing such wonderful insights on this World Rabies Day, and telling us about how to take the measures and how to prevent it. So thank you so much for that, sir.
Thank you.
With this, we would like to conclude the session here for today with all your last comments, sir.
Ma'am, I am grateful to your organization for giving me opportunity to speak on this day